you're going to love this treatment. If you suffer with foot pain from just standing too much, from being on your high heel shoes, if you love a foot massage, or if you suffer pain from having plantar fasciitis, heel spur, if you have arthritis in your joints, okay, from gouty arthritis, which is very painful, rheumatoid arthritis, and degenerative, osteoarthritis, this will help you a lot, okay? This is my optional accessory, the foot relief massage pads. And when you use the foot massage pads, just use them alone. Do not use it with other regular pads. So just use the foot pads alone. Take your socks off because the foot massage pads have to make direct contact with your skin. And oh, by the way, if you have circulatory problem, this is the best thing to stimulate the circulation in your lower limbs, all right? So if you have any circulation problem, do this on a daily basis and you'll feel much better. Okay, so basically, we just take the foot pads, we plug them in, okay? Doesn't matter which side. And take your socks off and sitting down. Now, these foot pads, they do not go in your shoes. They just go on the ground, okay? It's not designed to be put in your shoes. So you just put your feet on, and then you just turn it on, okay? Until, woohoo, that feels nice, okay? Until you actually feel the stimulation and the circulation rising up your legs, okay? And depending how high you turn it up, you can feel the stimulation go all the way up, and it's a wonderful sensation, okay? And you get a really nice massage in the bottom of your feet. So basically help to reduce inflammation, stimulate the nerve, so that if you have any numbness, it's going to help to restore the sensation. So this is very, very important for any of you who suffer with diabetes, okay? If you happen to have chronically sprained ankle or chronic swelling in your ankle or your calf, use this, especially if you're going to be sitting for any length of time. Just put this on the floor when you're sitting in the office or when you're riding on the plane or even in the car for a long period of time, okay? This only uses batteries, so you can take it anywhere. So use that continuously. If you have pain in this toe, this is great, okay? That joint, for a lot of you ladies, you get arthritis in this toe because you wear your high heels and and your toes all get all pushed in like that. You feel like me, I play a lot of sports, I abuse my feet all the time, like I bang things up and, I get so sore from standing all day, doing work at, standing in trade shows and walking for long hours. So I use this at the end of the day. It just relaxes you, okay? Not only that, if you take a close look, these pads, let's turn off, they have those special knobs here. They're designed to stimulate the reflex points to help to balance the nerve energy in your body, okay? In Chinese medicine, we believe reflexology or foot stimulation can help restore balance in your body, okay? So, I would suggest that you use this on a regular basis to relax you, okay? And to relieve any pain, to restore circulation, reduce swelling. It's just a wonderful, optional accessory to use together with my pain therapy system. Enjoy it. Now the foot pads, if you have these, okay, those do not need to be replaced. They will last you a lifetime. So they're fantastic. And if you do find them don't conduct as well as you like because you got very thick skin on the sole of your feet, or if you happen to have some kind of neuropathy from diabetes or severely pinched nerve in your back, say your feet's all numb and you don't feel the sensation, one thing you can do to improve the conduction is you can actually put a little water either on the bottom of your feet or on the foot pads themselves, and that'll help to make the conduction better, okay? So that's another tip for you. So take care of your electrodes, and it will take care of you. Now, if you have pain in your ankle from a sprain, old fractures, or if you have arthritis in your ankle, or if you have swelling in your ankles, do this treatment. Now take the big pads, and then put one on each side of your ankle. Now one thing you have to be aware of is that make sure the pads are not touching each other. See, if the pads are touching each other, then the current will go through the pads and not through your body So make sure the pads are not touching each other. Very important. So let me space them apart even more, so you have a really good idea that they are not touching each other. All right? Okay. So once you got them on, and then you just turn it on. Okay, and just like that. And again, we want to turn to the point where we're actually feeling a little bit of movement in the muscle around the area, because that will help you to get your best results. Now, if you happen to get swelling in your ankle from sitting on a plane, or or sitting too long, period. If you're diabetic neuropathy, you can use this while you're sitting on the plane, or when you're traveling anywhere, or even when you're sitting in the office for long hours, okay? If you have a recently sprained ankle, then keep this on all day long, okay? You don't have to worry about overusing it. Just, stimulate it and do the exercise. I taught you, I'm teaching you in the DVD, okay? If you do that, you're going to see much better recovery. Just use it as often as long as you can. If you have a recently sprained ankle, it'll help to reduce the inflammation, you improve the circulation, and speed up the recovery of the overstretched ligament. So, and relax the muscle around the area, so you get much faster healing than if you don't do it. All right. Now, if you have a recently sprained ankle and it's really bad, it's all swollen up, you can't put any weight on it, you can't walk, best thing you do is to leave the pads on and keep it stimulating all day long. Okay. The more you do it, the better it is. And also do the exercises that I show you in the video. If you have chronically swollen ankle from poor circulation, or if you have diabetic neuropathy, then again, use it often. Use it while you're traveling, sitting on that plane, sitting in the office, even sitting, watching TV at home. Just use it often and regularly, and you'll see the best results. Now, if you have pain in your ankle from arthritis, or if you happen to sprain your ankle badly, then you should be doing the following exercises, okay? What I want you to do is just move your ankle back and forth in its full range of motion as often as you can. So just like this, okay? Watch. So just moving, point your toes down, point your toes up. Toes down, toes up. Toes down, toes up. Just whenever you have a chance, just keep doing that. Pump your ankles, okay? Just pumping it will help it heal itself. Now, you also need to set the ankle back into its place. So what you do is find yourself a step, okay? Hold on to something, and then just step on the edge of the step and put some weight on your legs, okay, to weigh down the ankle. So to push the ankle deep back into the socket, just like that. And also help to stretch out your calf muscle, okay? So just like that. And to strengthen the ankle, then what I suggest, you just go up and slowly sink down. Go up and slowly sink down. And just repeat that every once in a while. So that will help you recover much faster than if you don't do these exercises. Good. Now, if you have knee pain from arthritis, osteoarthritis, rheumatoid arthritis, gouty arthritis, or sports injury, okay, like a ligamentous tear, menisci tear, if the tear is minor, okay, you can actually use my machine to help treat yourself for excellent results. And it's very easy to use. All you do is use the large pads here, the large flexion pads, and put one pad on each side of your knee. Just like that. Okay, and just turn it on until you feel a nice stimulation. All right. Now, besides using the stimulation, you should also be doing the passive exercise I'll be showing you, okay, as part of this DVD series. And you should also take a supplement, especially if you have joint cartilage, degeneration or damage. You should take some joint supplements, and you can always go on our website to find out which supplement is best for that. So I suggest you stimulate the area at least 20 minutes at a time, 3, 4, 5 times a day, or whenever you can. In fact, if you happen to have a sit-down type of job, You can actually have this on all the time. The more you stimulate, the faster it's going to get better. All right? So basically, this is the main treatment on both sides of the knee, and that's what you do. Now, some of you may have some pain behind the kneecap, the patella. Then what I suggest you do, you just put the pad above the kneecap, okay? And then the second one, in any way you like. But we want to stimulate this area because there's a small blood vessels that goes to the kneecap, and we want to stimulate the circulation of that blood vessel to help it further. Okay, so just like that. Now, if you have a lot of swelling in your knees, this is also good because this gets the circulation going to reduce the inflammation. If you happen to be the type of person that get a lot of swelling in your legs overall, okay, whether it's your knee, your calf area, use it in this area, plus you can use it on the calf muscle to actually use what we call the muscle pumping action to help drive the lymphatic and the blood circulation to help to reduce the overall swelling, all right? So try that and you'll see excellent results. Now, some of you may be getting what we call patellofemoral joint syndrome, meaning you get pain behind the kneecap, okay? It's not the ligaments, it's actually behind the kneecap. And that can be caused by imbalances of the muscle that control, okay, your leg movement. So if that's the case, I would treat the knee. So go to the section where, I teach you how to treat knees. But I will also treat the muscle of the quadricep, especially this muscle here, what we call the vastus medialis muscle. So we put one pad there, okay, as one, as part of the treatment, and then we stimulate because we want to make sure the tone of this group and this group are normal, okay? If we do that, then the kneecap will stay in better alignment because you're pulling on it evenly. It's like different cables. If one cable is too tight, then the alignment is coming off. But if both cables are equally, have equal tension, then the kneecap's going to track better, within the knee joint. So that's going to make it work better. So for the vastus medialis, and then the other group on the outside. So in the fancy name for this muscle group is the vastus lateralis. Okay. So basically, this is what we do. All right. Time-wise, usually I keep the treatment around 20-30 minutes because that's the amount of time you need to help to see and measure a big difference in improvement. And repetition, anything from 3 to 5 times a day or as you need it is fine. Again, don't worry about overusing. Now, if you had knee surgery or if you have metal implants in your knees already, you should be using the pain therapy system on your knee because it helps to break up the scar tissue, help to reduce the inflammation, and relieve the pain. Now, it is perfectly safe to use the pain therapy system on any area where you have metal. So if you have metal implants in your knees, go ahead and use it. It's good for it. Now, if you happen to feel like pins and needle, all you have to do, just move the pads over slightly, and then that's fine. Also, if you're on any medication, or if you're diabetic, you can also safely use this device because there's no chemicals involved. So you can use it for long term, as often as you like, with no side effects, only feeling good. Now, one exercise I always recommend for anyone with knee pain, especially if you have arthritic changes in your knee joint, is to passively swing your legs. Now, I recommend you swing it about 2,000 times a day. Now, that may sound like a lot, but it really isn't. And what I recommend is you just do about 100 each time and just do it throughout the day because it's going to really help to lubricate the joint and help to re-stimulate some cartilage, new cartilage regeneration. So watch my knees, all right? So very simple. Just support yourself somewhere, by holding on to something, and just gently swing that knee, okay? We're not working the muscle. We're just gently and passively moving that joint within its range of motion, okay? So full range of motion. I want the knee to be bent and then straighten out, but very loosely, okay? Just like that. Very loosely, right from the hip. So it's very fast to do about 100. So to do 2,000 a day, it really is very simple. And if you do that, it's going to really help to improve the overall health of your knee. So continue to do that, and you're going to see some big changes over time. Now, if you get pain in your calf muscles, or if your calf muscle happen to go into spasm, during the night, you can use my pain therapy system to help to relieve the muscle spasm. Also, if you get swelling in your legs, if you have ankle problems, if you have diabetic neuropathy, poor lymphatic drainage, this same stimulation on the calf muscle is going to help with all those different conditions. So we're going to use a large pads. In fact, use a large pads for your entire body except for your neck and face. So basically 2 ways you can do it. You can put 1 pad on each side of the calf muscle, just like that, okay? And just turn it on. And again, it doesn't matter which mode you choose to use. They will give you the same results. But you do want to turn up to a point where you're actually getting some stimulation and muscle activity. You want muscle to contract and relax because it will squeeze the lymphatics, squeeze the blood vessel, and release them to help pump the fluid and pump the inflammation, from your lower limb. So it's going to be very good for anybody who suffers with circulation problem, and also anyone who gets cramping in the calf. Now, second pad placement is this. I can just put 1 pad behind the calf, and the second one goes behind my knee. Now, this position might actually be more effective for those of you who have what we call sciatic nerve problem. If you have pain or numbness that runs down from your back to your hip all the way down your leg, then you want to try the pads, in these 2 areas, because we want to stimulate the circulation of your sciatic nerve. Okay, so let me turn it on or turn it up, and then turn on. Again, we want to turn up to a point where we're actually seeing and feeling some muscle contraction and relaxation. And as you may have experienced by now, the sensation changes all the time because my device is programmed to modify itself so your body never get used to it. That's why this is one of the most effective pain relieving and healing product there is around. Okay, and this feels really good, and this may allow you to get rid of that cramp and get a better night's sleep. Okay, so take care. Now, if you suffer with pain at the front of the leg or the shin area, or if you get what we call shin splint, now you need to rest the leg. Okay, if you're a jogger or a walker, just rest it a little bit, and then use a stimulation from the pads to help to restore good function there and to relieve the pain. Now, the first pad, just put it below the knee on the shin side. And then the second pad can go just anywhere you want, but just a little bit below is good. Now, first pad should go on here because there is a nerve that exits from this part of the leg, and we want to stimulate that nerve in order to get the healing going on. And all you do, just turn it on. And then you want to turn it on to a point where you actually get muscle contraction and relaxation. And you can use any mode you like, and do it for at least 20 minutes. And you can repeat it 3-4 times a day until you see your maximum recovery. Okay? So that's basically what you need to do to relieve your shin pain and shin splint. But if you do have shin splint, that means you got some microfracture within the shin bone, so you should be taking some rest. But the stimulation is going to recover much faster.